Let's talk about PTSD, post-traumatic stress disorder. Post-traumatic stress disorder. What's the timeline? Usually, the timeline is a month or so, more than a month. That is the classic timeline for PTSD. Why it happens? It happens after a specific trigger, and that trigger is exposure to very traumatic events. The trauma can be exposure to death or near death experience, such as we can think of soldiers in an active war. Soldiers in an active war, they often experience death and near death experiences. Maybe a serious injury, for example, someone experiencing or someone involved in a crash, or maybe in case of women, sexual assaults. In patients who have experienced a natural disaster, such as flood or tsunami, or any other major natural disaster, such as earthquakes, those patients living in the vicinity of those natural calamities can also develop a PTSD, post-traumatic stress disorder. Now let's talk about the symptoms. What are the classic feature of post-traumatic stress disorder? The patient obviously will have a history of the trigger, and the symptoms usually persist more than a month. That is the background. And the symptoms can be grouped into 4 types: re-experience, hyperarousal, avoidance behavior, and altered level of cognition. Re-experience means the nightmares, the flashbacks of the events. So re-experience means flashback of the war, flashback of the accident, flashback of the sexual assault. And oftentimes the patient has nightmares and they arouse in a very agitated state. That is a re-experience. And the hyperarousal makes the patient very vigilant. They are hyper alert, very vigilant, and they easily become startled to the change in their environment. That is hyperarousal. And that actually leads to a decreased sleep. They can't sleep because they are very anxious and they can't concentrate. Avoidance behaviors, such as any situation that provokes the re-exposure or makes the flashback, those patients avoid the situations or the places. Altered level of cognition, where the patient feels detached to the environment, feels detached from himself, and they lose interest. They feel detached to their feeling. They don't have attachment to their own feeling. They feel detached. They feel they're someone else, somewhere else, and they lose interest in the things they previously enjoyed. They have a lack of interest. So those are the symptoms. Now, how to manage a patient with PTSD? The initial step of management is CBT, cognitive behavior therapy. But the most effective treatment is EMDR. EMDR stands for eye movement, desensitization, and reprocessing. Eye movement, desensitization, and reprocessing. Oftentimes, the patient run through a simulation of the events that he experienced. So that is one of the ways how we can provide this therapy, through realistic simulations in the computer of the traumatic events. That helps the patient to process it. We can also help the patient with stress management strategies, and antidepressant drugs acts as an adjunct. What's the prognosis? Most of the patients with PTSD recover within a 2-year period, but some may develop a chronic PTSD